The digestive tract is simply all the organs that are instrumental in digestion. It starts with the mouth, which is sometimes called the buccal cavity. The mouth has three main components: teeth, the tongue, and saliva. Teeth are hard structures. The tongue is a muscle. Saliva is the liquid inside the mouth. It is a chemical substance that contains enzymes. The food we eat starts to be transformed in the mouth. Once it leaves the mouth, food goes into a tube called the oesophagus, which is about 25 centimeters long. A muscle at the bottom of the throat opens and closes the oesophagus. The muscle is called a sphincter, which either allows or prevents food from passing through. There are several sphincters in our digestive tract. For example, there's another sphincter at the end of the esophagus to control the entrance of the stomach. The stomach is a G-shaped muscular pouch that expands when it receives food and drinks. Its average size is 1.3 liters, but a heavy beer drinker's stomach can reach a volume of 4 liters. And as you may have guessed, there is another sphincter at the bottom of the stomach to regulate the movement of food towards the small intestine. It is called the pylorus. The small intestine is a narrow, coiled tube that is more than 5 meters long. To put this in context, if stretched out vertically, it would be equivalent to the height of a giraffe. The duodenum is the first part of the small intestine, but since it is closely related to the liver and pancreas, it is often treated separately. The liver and pancreas are considered accessory digestive glands because, although they play an important role in digestion, food never actually goes through them. It is mainly in the small intestine that nutrients move into the blood to reach our body cells. The last organ in the digestive tract is the large intestine. It is about 1 meter long. Nutrients first pass through another pouch located between the small and large intestines. This pouch is called the cecum. It has a small appendage called the appendix, and the appendix doesn't participate in digestion but may become infected. Such an infection is called appendicitis. The large intestine is sometimes also called the colon. Just like the esophagus and stomach, it also has a sphincter at the end. Most of the time, this sphincter is closed, except when stools are evacuated through the anus. This course is also associated with a game called Tubix. In this game, you need to place the organs of the digestive tract in the correct order. So the mouth comes first, the esophagus goes after the mouth, but before the stomach, and so on. You can play Tubix at various levels. The higher levels look at the anatomy of the digestive tract in more detail. The colon is also divided into 3 parts: the ascending colon, the transverse colon, and the descending colon. In digestics, the order in which you place the digestive pieces matters as well. If you don't start with the teeth, for example, you won't manage to transform food into fragments. The anatomy of the digestive tract is complex. In addition to the main organs, we also need to consider the accessory digestive glands.